Welcome back. My name is Danny Sasseto. Sign language interpreter is Millicent Randa. And today is the budget estimates and statement that will be delivered to the Parliament by Cabinet Secretary FCPA John Mbadi a little bit later. But even as we continue with this special coverage of the same, a lot more areas that are being looked at in terms of the budget, which is 4.8 trillion shillings. Who are the winners? Who are the losers? And how exactly are we going to finance this budget in terms of appropriations and also just sealing the loopholes that do exist? It is a coverage that encompasses all these areas in ensuring that as we approach that time when the Cabinet Secretary, FCPA John Mbadi, will be making his way to Parliament and delivering that statement to the National Assembly, that will be there to keenly listen to each and every single aspect of the budget 2026-2027. A little bit later, we shall be having a conversation with Karaya Mokaya, who is the member and Public Finance and Tax Committee. ISPAC. We shall be having that conversation with him a little bit later to just delve deeper into this budget. But we go straight to the Parliament buildings, where we have a reporter, Alan Ochanda, who is going to be having a discussion with Kibra Member of Parliament to just look at matters to do with the budget, especially on matters to do with education. Good afternoon to you, Alan Ochanda. Education is a big recipient of the budget at around 470 billion shillings.
Well, Steve, it is the big day, the day when Kenyans are expecting the annual ritual of budget reading, where CS Treasury John Mbadi is expected to make his way to Parliament in an hour or 1.5 hours time. Of course, Treasury is just some few meters from Parliament, where we have pitched tents since morning. The 4.8 trillion shillings budget, which according to critics, they're saying it's quite maybe just chewing more than we could swallow. But looking at it, the opposition was proposing that it should be scaled downwards and be at 4.3 billion shillings, less 500 billion shillings from the 4.8 trillion proposed by the National Treasury. But of course, since morning we've been speaking to some of the stakeholders here, and they are talking about a huge chunk, significant percentage of the budget being directed to President William Ruto's pet projects, and of course huge chunks being directed to sectors like agriculture, education, infrastructure, and health. Remember that in education, matters of capitation, infrastructure have really been captured in that particular budget estimates. And so we are waiting by around 2:30 when the CS Treasury John Mbadi will be making his way here to just make it public to Kenyans what they really expect in those budget estimates here. What are the goodies? Now remember that they say the devil lies in the details, but we are majorly looking at what could be the goodies in the budgets here. And so let's just talk to the Member of Parliament for Kibra, Mwalimu Peter Orero, to maybe just shed some light on what we expect in the what he expects in the budget estimates that will be read to Kenyans in an hour or 1.5 hours time. Mwalimu, karibu sana. From where you sit, you are a Member of Parliament here in the National Assembly here representing Kibra. What goodies do you expect in the budget that will be read to Kenyans in an hour's time? Could just use your microphone, kindly.
Yeah, I think it's a big budget that is 4.8 trillion. The national government is going to take over 2.2 trillion. We have other areas that we are also looking at. The education sector is going to take about 781.5 billion. Then we have yesterday, when we were doing the appropriation bill, it was called mediated appropriation bill, because when the budget for devolution went to Senate, the Senate had wanted that the budget is maintained or is taken to 454 billion, as was agreed by the 10-point agenda between the ODM and the UDA. So they really insisted that the devolution must be given the amount that was agreed. But after mediation yesterday in the evening, they agreed that the devolved system be given 428 billion. Now, this was a middle ground because the fiscal deficit, we have a big gap. A fiscal deficit is quite big, and to bridge that gap, it was not possible that the devolution be given 454 billion. So, and the external borrowing and the domestic borrowing, you realize that in this budget, we are going to have more of the domestic borrowing. But the economists say that the domestic borrowing has more interest rates. So we don't know whether we are going to fill this fiscal deficit because I am looking at the prospects of having another supplementary budget after this budget, so that we look at the collection of revenue and see whether the fiscal deficit we are going to fill as required. Now, the revenue collection must be enhanced so that we do not have a lot of external borrowing. Since we have a lot of funding, we will be going to the energy sector, the agricultural sector, the education sector, the infrastructural sector, and knowing that now we have the National Infrastructural Fund. I think this budget, I am saying it is not too ambitious, but again, it is going to have an effect on the common mwananchi, because to raise some of this fund for these projects will be a big tussle. But basically, myself, I'm in the education committee, and that is where we carry budget estimates, and that is where we have also allocation. One of the biggest allocation in education at 781.5 billion. But maybe we can look at it, how it is allocated in various either higher education, basic education, the primary, the secondary, the junior secondary, and all that, the TVET and those areas.
Maybe you're talking about education where you sit as a member in the National Assembly's Committee of Education. If we could touch maybe quite briefly, because we also have Mheshimiwa Mathenge here to also touch on some issues that touches on his committee. We're talking about education. There's the issue of infrastructure, capitation, and now you've seen that pattern of unrest in school. It's quite deep. But some people argue, some stakeholders argue that there must be some budget set aside so that to check on the mental health, so that maybe they could set up in specific, or not just specific schools, but in all schools to ensure that the mental health of learners is actually checked. It also has budgetary implications, and tying that with the issue of meager allocation for capitation of learners. How should that be addressed in this particular budget? Or maybe the unrest of schools could be in the supplementary budget?
Of course, as we are speaking, that department of psychosocial support in that department, if we talk about psychosocial support in secondary or primary school or whatever category of school we are talking about, it is not captured in the current budget estimates. But essentially, we need to have a fully fledged department of guidance and counseling, or what we call wellness center, so that these students are taken through a psychosocial support system, so that we don't have this kind of behavior. Now, the capitation that we have currently, the junior secondary is given about 30 billion as capitation. The senior secondary is 54 billion. And the primary is 7 billion as capitation. But you know that sometimes the capitation, not all of portion is given to the school, and it takes some time depending on the revenue collection of the country.
Maybe before we could move to the main occasion, let's just donate some minutes to Mheshimiwa Duncan Mathenge, Member of Parliament for Nyeri Town, and a member Committee Health. If I'm not wrong. Maybe from where you sit in the Committee of Health, we've actually been seeing stakeholders complaining, especially the allocations for SHA reimbursements have actually been coming in late, and of course the whole health really touches on each and every Kenyan, be it in the rural or urban setups. From where you sit, your committee, do you think this budget has satisfactorily catered and captured all the needs pertaining health?
The budget is satisfactory based on the available revenues, global revenues in the country. The budget is unsatisfactory based on the desire expressed by African countries in the Abuja Declaration, where the desired allocation to the health sector ought to be 15%. We are at 7% currently. However, Kenya has made a major shift where we are shifting from largely concentrating on curative services and shifting to an approach where we capture diseases early enough before they progress, and that is primary health care. And we set up the Primary Health Care Fund to cater for health services at the lowest level. Services provided by our community health promoters, 110,000 of them. Services provided at the dispensaries and health centers and selected level 4 hospitals, outpatient services, where nearly 90% of health Kenyans seek their health services and they are served. And what we have done is that we have increased the amount of money available for primary health care from 13 billion to 19 billion this year. Secondly, we have decided to streamline the movement of the money from the Primary Health Care Fund under SHA directly into the accounts of the health facilities in the villages, into bank accounts where the signatories are community committees that are elected by the local communities, meaning that those committees should look at any shortages of supplies or any absence of services, and before the main supply line through KEMSA has been able to replenish, they can plug in the gaps from locally available outlets. The second one is the tertiary institutions, level 6 hospitals. Initially, this country had 4 level 6 hospitals: Kenyatta University, Kenyatta National Hospital, Moi Teaching and Referral Hospital, and Mathenge Psychiatric Hospital. Now we have added 2 new ones: Moi Kibaki in Othaya, and the Moi and the Jaramogi Teaching and Referral Hospital in Kisumu. We have also increased the amount of money available for the level 6 referral facilities.
Nice.
And therefore you find we have a better distribution this year than in the previous budget, and the health budget has indeed increased by 48 billion.
Nice. Well, Aseto, listening from the members of parliament here who sit in quite crucial committees here, health and education respectively, really talking about how the monies will be distributed. Of course, education and health really touches on each and every Kenyan in every corner of the country. And from what Mheshimiwa Mathenge is actually talking about is that SHA, they now actually just ensure that they wire money straight to the facilities to ensure that there's actually transparency. But on the part of devolution, remember that we've had a situation where the accounting officers are actually sitting in the respective departments that were actually devolved. But remember that there is that proposal to ensure that governors are also accounting officers, so that they could be accountable. They're actually the county bosses. And so with such when the money is actually trickling down to the villages, to the counties, then of course, just to ensure prudent utilization of the public resources, those are some of the proposals that are actually being tabled. But I understand that the main occasion is actually just almost kicking off. And so we are actually just moving straight to the main occasion. Aseto.
Thank you very much, Alan Ochando, there joining